One. Pardon me?
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe, and joining us virtually is Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, and the CEO of the Saskatchewan Health Authority, Scott Livingstone. We will have opening remarks followed by time for questions.
Thank you very much, and good afternoon, everyone, and thank you for joining us today. Over the past couple of weeks, the Saskatchewan Health Authority, as well as pharmacies across Saskatchewan, have been vaccinating or offering vaccinations at an incredible pace. In the past week alone, over 131,000 Saskatchewan people have received their COVID shot. That's about 13% of all eligible residents that have received a vaccination just in a single week. Over 40% of eligible residents are now fully vaccinated in our province. In fact, Saskatchewan is the first province in Canada to reach 40% fully vaccinated. And if we maintain this pace, about 60% could be fully vaccinated by the time all restrictions are lifted on July the 11th, and over 70% would be fully vaccinated by the end of July. So this is not a one-dose summer in any way. It is a two-dose summer. It is a great summer for the vast majority of Saskatchewan residents. The vaccines are truly working as well, which is great news. As vaccinations continue to rise, COVID transmissions continue to decline. Our 7-day average of new cases is now at 46. That is down 84% from the third wave peak of 287 that we had seen in mid-April. That is a direct result of so many people doing their part, yes, following the measures, but also going out and getting vaccinated. We now have more than enough vaccines for everyone, and clinics are open in every corner of the province, so there is really no reason for you to not be vaccinated other than your own personal choice. If you are making that choice, I would say that you are making a mistake. Next week, we will release our updated numbers for the month of June, breaking down the number of new COVID cases by unvaccinated people, partially vaccinated people, as well as fully vaccinated people. And I'm sure it will show, as it did in May, that the overwhelming majority of people who are now contracting COVID and are becoming seriously ill are ultimately unvaccinated people. The Public Health Agency of Canada recently released some figures showing that since vaccines have been widely available, over 95% of new cases in Canada have been in unvaccinated people. About 4% of those cases were from partially vaccinated people, and about half of 1% were from fully vaccinated people. So vaccines are working. Vaccines are significantly lowering the risk for Saskatchewan residents and for all Canadians, except in those of us that may choose to not be vaccinated. For you, you are still at risk, and there is no reason for you to be at that risk. So please, consider going out and getting vaccinated. Because of our increasing number of vaccinations, decreasing case numbers, we are feeling quite well about where we are at with our reopening roadmap in Saskatchewan. Feeling very well about moving to step 3 and the complete removal of all public health orders by July the 11th. At that point, there will be no restrictions on gathering sizes, no requirements to wear a mask, although you may want to continue to wear a mask in certain situations, in particular if you are not fully vaccinated. That will be totally up to you. It will also be up to businesses and other employers to decide whether they want to keep any of their COVID practices that they currently have in place past July the 11th, such as physical distancing, access to hand sanitizers, mask use for their employees, and potentially even customers. The business response team is working actively with Dr. Shahab and his team, and they have developed and released some guidelines for individuals, for businesses, as well as for employers to consider. Once all of the mandatory rules and restrictions are removed on July the 11th, those guidelines will then be released and posted on the government website over the course of the next few days. There's also been some question about whether certain venues and events can ask for proof of vaccination before allowing people to attend those events. That will not be a provincial requirement in Saskatchewan. Of course, our government is strongly encouraging every eligible person to take the time to go out and get vaccinated. But it would be a potential violation of health information privacy if we were to do this, if we were to ask for anyone for the proof of vaccination in order to attend an event. That said, as always, we want everyone to go out and get vaccinated. We have the vaccines available in our clinics and pharmacies across this province. Vaccines are proving to be very, very effective at protecting Saskatchewan people, thereby driving down our case numbers, driving down our hospitalizations, and ultimately saving lives each and every day in this province and across this nation. So let's all get vaccinated so that we are all ready for things to get back to normal in our province here in under 2 weeks, when all the restrictions will then be lifted on July the 11th. On another note, I hope that everyone does have a great Canada Day in Saskatchewan. I hope they also take a moment to reflect on the history of our province and our country. Both the things that we can all be proud of, as well as to take a moment to reflect on the things that we should not be so proud of. This is a great country for the most part because as individuals and as organizations, as governments, we do respect and value all people regardless of their race, religion, their gender, or their sexual orientation. And when you look back historically, the worst moments in our Canadian history is when we have forgotten to do that. When we have violated that ideal of equality and respect for everyone. We can all learn, and I would put forward that we must all learn from that to make our nation and our province an even better place in the days ahead. Dr. Shahab.
Thank you, Premier. So I'll begin by expressing my condolences to the families and friends of the 3 Saskatchewan residents who have passed away as a result of COVID-19 since our last briefing last Thursday afternoon. We continue to see sporadic cases, particularly in those parts of the province where vaccination rates are still lower than where we would like to be. So that's mostly the Prince Albert area, the northwest part of the province, and the far north. Vaccination rates are increasing throughout the province, and even in the far north and north. There are many communities with very high vaccination rates, but the Saskatchewan Health Authority and Indigenous service partners are continuing to bring vaccines closer to communities that may not have been able to take advantage of all the opportunities so far. And even when when vaccines are brought, we are seeing a significant increase in uptake, even in pockets which are under-vaccinated. So again, I think that momentum needs to continue to make the entire province safe for reopening in step 3. And as we move forward, obviously, once we have reopened in step 3, public health will continue to monitor and respond to COVID-19 cases and outbreaks, just like we do with any other endemic vaccine preventable illness. Because we know that while the pandemic continues in many parts of the world, primarily due to lack of access to vaccine, COVID will, for the foreseeable future, be an endemic illness in Canada with occasional outbreaks and clusters, which public health will have to respond to. And in that sense, public health will maintain its core programming to monitor and respond to localized outbreaks, which are likely to happen more when there are gatherings or pockets of individuals who are primarily unvaccinated. Testing will continue, as well as content investigations based on positive test results, following the procedures that are now in place, which includes that if you're unvaccinated and a close contact of a confirmed case, you will be required to self-isolate for at least 2 weeks. And testing will continue to play a vital role in early identification of outbreaks. We have had a few instances where individuals were unwell, did seek testing, which is great, but then did go on to attend a social event, which resulted in settings where there were other unvaccinated people in outbreaks. So again, a reminder that it's important to complete our vaccination schedules, and at any time, irrespective of your vaccine status, if you are unwell, stay home and get tested. We will also obviously continue to issue public service announcements in settings where communities or events where the risk of transmission remains high, or we cannot connect with all potential contacts. And this is not new. We do that all the time for other vaccine preventable diseases like measles, mumps, whooping cough, and we'll continue to do that with COVID. And again, we have to remember that many common respiratory illnesses really went away over the last 16 months because all the precautions that were especially around COVID. So obviously, unfortunately, we may see a resurgence of other respiratory illnesses as well in the fall, and COVID could be one of them. But hopefully, it will not be a pandemic. It will be sporadic cases and clusters, just like with other respiratory illnesses and other vaccine-preventable diseases. And again, the higher our vaccine rate continues to go first dose and second dose over the summer, the better we'll be placed in the fall. COVID-19 case information on rates will continue to be posted on Saskatchewan.ca, and provincial medical health officers will continue to monitor trends. If we do observe a substantive increase, under the Public Health Act, necessary local measures can be taken, just like with other outbreaks. But again, the higher our vaccine uptake, the less likely those events become. And again, one vaccine provides good protection, but 2 doses are required for optimal protection, and you're fully protected 2 weeks after your second dose. Survey after survey shows that, while 10% of the population may be quite hesitant, for the remaining 20% who haven't yet received the first dose, really it seems to be more of a question of convenience and complacency, not so much of hesitancy, because whenever the SHA and partners have done pop-up clinics, brought vaccine closer to where people work and live, uptake has been high. But again, I really encourage all residents who still have not taken their first dose to keep an eye out of what's happening in their local area. And even if they're out and about in another part of the province, take advantage of any clinic that's accessible to them. Anyone who's a resident of Saskatchewan can get vaccinated anywhere in Saskatchewan. We're coming to the point where, while mass vaccination clinics may continue or reduce in frequency, there will always be vaccine available throughout the summer and into the fall. And in addition to pharmacies, the Saskatchewan Health Authority will be continuing with, initiatives to reach as many people as possible. So, all these things will make it possible for us to, enjoy the summer, go to events, travel in a safe way, especially by being fully vaccinated, and help us to be better prepared for the fall as well. Thank you.
Thank you. Thank you, Premier Moe and Dr. Shahab. We will now take questions, and we'll start in the room. Arthur?
Sure. So you said that there are privacy concerns with the prospect of requiring proof of vaccination for large-scale, say, stadium-type events. I'm just kind of wondering on what basis you came to that conclusion. Did you seek a legal opinion of some kind? Because it does seem like this is something that's being done elsewhere, particularly Winnipeg. It seems like they're going through a similar sort of system, and particularly because it seems as though a large fairly large majority of the province's population here does want to see something of this sort, according to a UFS survey that just came out.
Right. Scott, I might ask you to maybe make a comment with respect to specific HIPAA privacy laws, things of that nature. First, with respect to polls, I'd say there's polls that are occurring all of the time. We don't govern by polls. We govern by proper policy, as well as what we can and can't do with respect to privacy information. I believe there's a story this morning from the Privacy Commissioner on requirements around producing information on whether or not you're vaccinated. The same would hold true for large public events as well. When we get past July 11th, we're going to be into an area where the emergency order will not be in place, and we most certainly don't have the ability then to demand that people would show a proof of vaccination for whether or not they would attend any large event here in the province. So that being said, there is an area where there may be some requirements to show a vaccination. They won't be in the provincial scope or sphere of influence, but in the federal, the national, or maybe the international sphere of influence, in much the same way that when you travel internationally now to many parts of the world, you do need to provide a proof of vaccination for malaria, for typhoid, some of these other vaccinations that are available. It's entirely possible that you're going to require to have a proof of COVID vaccination in much the same way that you do now to achieve or to attain a visa to visit some of these countries. And so internationally, there will be quite likely some parallel requirements to enter other countries, and maybe even some requirements to provide a proof of vaccination to not have to participate in a 2-week self-isolation period on your return to Canada in the nation as well. And so we're working with the federal government on how that information could be provided, quite likely through the individual, if they should choose to provide it or not. But with respect to provincial vaccine passports or requirements to be vaccinated to attend certain events or to work in certain areas or anything of that nature, the government of Saskatchewan is not moving that direction. Scott, do you want to comment at all on HIPAA laws themselves or the legality of requiring, I guess, a vaccine proof of vaccination to attend an event, and how that might be, how that could or could not be impacted, I guess.
Premier, so of course Arthur could always follow up with the Privacy Commissioner. We'd probably be in the best position to give him quote unquote the HIPAA regulations, but I can confirm, post the removal of public health orders and the state of emergency on July 11th, we'll go back to our normal processes of accessing information for residents. Remind folks that even your health card number is personal health information. Banks are not allowed to ask for your health card number, and nobody else is. For a form of ID, it is personal information, and so is vaccination status. So the Premier is right that it is within the HIPAA regulations. That is personal health information, and it's not a requirement for an individual to one, provide it, or other individuals to even ask for it if it's not related to the provision of health services.
On this, and Dr. Shahab has been saying this for quite some time now, that once you're eligible, you're always eligible for your first dose, and ultimately 28 days later, your second dose. And I think this is an opportunity for us to just again reiterate and reinforce the importance of everyone to go out and to make the choice to get vaccinated. We continue to climb past the benchmarks that we had set out. 40 plus, I believe, is about 80% vaccinated now, 30 plus about 75% vaccinated. But I think this is an opportunity for Saskatchewan people to really, in unprecedented fashion, as we find our way through the summer, to please make that choice to go out and get vaccinated. We have always said get vaccinated to protect not only yourself but those around you. As we get back to a more normal interactions in society, larger events, I would really urge now everyone to give some thought to the fact that now you need to get vaccinated to protect yourself. We are going to learn to live with COVID. We aren't going to get through or cure COVID in any way. We're going to learn to live with it. And if you choose to not be vaccinated, and I read the stats out earlier, you are choosing to live with much higher risk of not only getting COVID, but ultimately getting quite ill from COVID than if you make a very different choice, which is to make yourself available to the vaccines that are available to Saskatchewan people. 0.5% of the active COVID cases, the new cases in Canada, are from people that are fully vaccinated. If that isn't proof enough that vaccines are proving to be very, very effective, I don't know what proof would convince you.
Follow up, Arthur?
Yes. Follow up. You talked a bit about Canada Day, and there have been a few decisions in a few northern communities to kind of perhaps cancel, perhaps postpone Canada Day because of the recent findings that we've seen at Cowes' other places. Kind of, first of all, wondering what you think of those decisions, and further, whether you think people should perhaps celebrate Canada Day in a slightly different way this year, given the findings, and what you yourself will be doing in that.
Yeah. Yeah, no, you know what? I know there's a number of communities that have chosen to not celebrate Canada Day or to delay that celebration until a later date. And I think that's entirely appropriate. And the decisions that are being made at the community level on whether or not to have a coming together or to forego that for a period of time, I respect both of those decisions that are being made across this province. I will be, celebrating Canada Day, recognizing Canada on Canada Day, and in a much lower key event, I will be. I think in addition to celebrating what I believe is a great nation, and a great nation with great opportunity that lies before us, and I'll come back to that in a minute. On this Canada Day in particular, I think I will also be reflecting much more than I have on other Canada Days as to our history. Both our positive history in this nation, but also our history that is not so positive and quite negative. And I had made some comments in my opening comments with respect to how we need to continue to respect one another, regardless of who we are, and to treat people with exactly the same degree of respect that we would hope to be treated with in return. So I will be having much additional reflection this year on Canada's past. But I also think, and I'll be reflecting on the words of Chief Delorme, where he'd said, what has occurred with respect to residential schools and the the identification of a number of unmarked graves, and we expect there will likely be more in the weeks ahead in this province and in this nation, that this is part of the reconciliation path, the reconciliation road that we need to travel, and we need to travel it together. All of us, Indigenous as well as non-Indigenous people. This was identified in the verbal accounts at the Truth and Reconciliation Commission, identified in the report as that part of the reconciliation process is to actually identify where these unmarked graves are and identify ultimately the individuals that lie within, and to help provide the first steps of closure for those families and friends of these individuals. And so this is part of the process of reconciliation. And Chief Delorme had spoken about how this was a previous generation that had made decisions with respect to this. This was none of us of this generation as individuals. But what we do have the opportunity as people of today, people of today's generation, is to determine how we act and how we move forward together as an inclusive society, as a respectful society. And I think that lies, yes, on governments, and this government has and continues to take steps to ensure that we are being respectful, we are recognizing our past, but trying to make as positive decisions as we can to provide closure for these families, but also to make positive decisions so that everyone is included in our economic society, in our communities, and included in our province ultimately. We also have a responsibility as community organizations, but I think most importantly as individuals, to ensure that we are, open and respectful in what we do each and every day, and educating ourselves, yes, on what Canada's shared history is with our Indigenous people and non-Indigenous people, and understanding that we need to do better as we move forward. I would just reference what I think is a very positive initiative. There's a number of people that are placing backpacks on the steps of the legislature. 751 backpacks, I believe, will be on the steps of the legislature. It provides an opportunity for all of us to raise awareness and to take the initiative to educate ourselves on what the residential school system was, and what it ultimately did to a sector, the Indigenous people in our society. But in those backpacks are school supplies that I understand will then be distributed to people, to kids, for them to utilize as they attend school this summer and into the fall. And I think that's also very indicative of taking some positive steps into the future. With these backpacks are there for us to recognize our past, but also filled with school supplies to help those as we move forward into the future. And there's no better place for that display of both initiatives than on the steps of our provincial capital building building here, the legislature in Regina. And so I just take a moment to thank all of those that have been involved in that initiative and all of that it represents. And I think in that initiative is a lesson for all of us to take and to reflect and to think about on, as we approach Canada Day this year. Celebrate however you feel is appropriate for you, but certainly take some time to reflect on, our shared history and where we're going as individuals and as communities, as a society and as a province.
We'll take our next question on the line. Operator?
We have Carla Shinkarek with CTV.
Hi. First part of my question, just in light of the current outbreak at Oliver Lodge Care Home in Saskatoon, just wondering if the SHA mandates how lockdowns are carried out at the different homes, or if it's left up to the homes, like, can they leave their individual rooms? Do they have to be confined to their floor? And can they go outside?
Scott, or comment, and maybe Dr. Shahab as well.
So the management of outbreaks across the province hasn't changed, and whatever restrictions are put in place would be guided by medical health officers locally. And as you know, that has resulted in different levels of restrictions for homes depending upon the extent of the outbreak and the guidance from medical health officers.
Dr. Shahab, anything to add?
Yeah, the only comment I'll make is that obviously, last 15 months were very significant in terms of significant restrictions, even in the absence of an outbreak, in terms of visiting long-term care homes. And then gradually those restrictions have been reduced significantly, especially because of the impact of 2 doses of vaccines in long-term care residents, where we have not seen the outbreaks that we saw earlier or other parts of Canada saw. But having said that, as we go into the future with living with COVID will be managed just like any other respiratory illnesses. Fortunately, last year we saw virtually no influenza outbreaks, but we know that every year we get numerous influenza outbreaks in long-term care, even though many residents are vaccinated. And then the response is very much a more localized, more long-term care or facility-specific response, where there's a single case. The resident may be isolated till they're better. If there's 2 or more cases, it may only impact a wing of the long-term care facility, and some restrictions may be placed for a shortest period of time in that wing. But it'll be very similar to in the past how public health has worked with infection control to manage other respiratory outbreaks like influenza or norovirus. Again, last year has been very unusual because we haven't seen a lot of these other communicable diseases go around, which, and that again reminds us, if we are unwell with any respiratory symptoms, GI symptoms, stay home till you're better. Don't go and visit someone in hospital, long-term care, school, or don't go to work if you're unwell. And I think those principles will serve us well, both for COVID and other respiratory or communicable diseases. Thank you.
Follow-up, Carla?
And second part to the question is, will the lockdown guidelines, I guess, for a situation like that outbreak for seniors' homes change as the province hits step 3?
Scott?
So without using the term lockdown, because I think Dr. Shahab has already addressed this, as we move into the endemic and learn to live with COVID, just like we have with influenza and other respiratory illnesses, outbreak management will be the same for COVID. It might have different degrees of restrictions or infection control practices depending upon the scope of the outbreak. But as you know, in long-term care, it is a very low bar that determines whether there's an outbreak, and it's closely monitored because the risk these seniors or our elderly and people in long-term care have. However, again, to Dr. Shahab's point, we know with COVID, with our very high double vaccination rates in our long-term care residents, we have put protections in place. So I don't suspect that we're going to see any changes to our outbreak management. However, COVID is a new virus. We've learned lots from COVID over the last 15 months, and we continue to learn from it. And we'll take the guidance of our medical health officers together with Dr. Shahab to guide what we do on a go forward basis. But as I think Dr. Shahab very clearly outlined, is we will manage these outbreaks like we have managed outbreaks across other respiratory illnesses, and we move into this next phase of our response to pandemic.
We'll take our next question on the line. Operator?
We have Adam Hunter with CBC.
Hi. What is the plan to get more people first doses? I know you guys mentioned that pop-ups have shown people are coming out. I know of a couple that have been pretty successful. Right now, we're trailing other provinces with Alberta as far as first doses go. Is there any concern that we're not going to have enough people first dosed and that's not going to protect the province? And what's being done to just get those numbers higher?
Scott, I'll maybe just make a comment and then I'll leave it to you to speak to the specifics of, the initiatives that the Saskatchewan Health Authority are undertaking to continue to make vaccines available for all people, first dose and second dose. As we know, second dose is crucially important as well, in particular as we're ensuring that we are vaccinating for all of the variants of concern that are present in Saskatchewan and across Canada. But I would just say with respect to the uptake of vaccines here in the province, Saskatchewan people have done very, very well. I mean, we're like 69.93 or 4% of everyone that is eligible to receive a vaccine has received a vaccine. That's on our covered population data. So that's on the data of the population that has a health card, a Saskatchewan health card. That is how we determine the 1,033,000 people that are over the age of 12. That covered population data in Saskatchewan is equivalent to about 1,225,000 people in the province that have a Saskatchewan health card. Not necessarily in the province, but that do have a Saskatchewan health card. We know there's not 1,225,000 people in Saskatchewan. Stats Canada data in this province is about 1,180,000 people, and some other provinces are using that Stats Canada data. We chose to use the covered population data from the beginning, but if we were to use the Stats Canada data like some other provinces are, we'd actually be 3.5% to 4% higher with our vaccination rates. Now, that's neither here nor there. Saskatchewan people have come out in large numbers. First shot, we're at 722,000 people have received the first shot. But yes, we want to continue to encourage those few 100,000 people that have not yet received their first shot to please make an appointment, find your first opportunity to go out and get your first shot, and then ultimately when it's your turn, get your second shot. You're living with an unnecessary level of risk when you understand that of the new COVID cases in our nation, 0.5% of them are in fully vaccinated people, and we'd like you to join that fully vaccinated group sooner rather than later. Scott, do you want to make some comments specific to the efforts that we're making? I think more so to make vaccines available to as many people, but yes, first doses. And I would just close with this. Throughout this pandemic, we've never, ever for a second wavered in our faith of Saskatchewan people in doing the right thing. We're seeing that continue through this vaccination program, and for that, I know all of us on the call here today are forever grateful. And we would just ask even more Saskatchewan people to make that decision to go out and get their vaccination. Scott?
And Adam, as we've talked about before, we continue to offer a number of options and clinics to stimulate first doses, but also to keep doing our maintaining momentum on second doses. Some of those things you've seen are pop-up clinics and newcomer clinics. We will continue to do so regardless of where we hit on July 11th. And, even over the last week or so where we've seen much smaller numbers of first doses than second doses, or second doses are skyrocketing up, and we're going to see some great numbers over the summer. But with the first doses, even at 12 to 15,000 a week, if you calculate that out over, the next 2 months until the end of August, that's another 100,000 Saskatchewan residents receiving first doses. We'd like to see that uptake faster. That's why we're trying to bring clinics out to as many sites possible to make it as convenient as possible for people to get their vaccinations, whether it's clinic at the lake. Over the summer, you're going to see a lot of, I just looked at the list of clinics. As you know, we opened up over 41,000 scheduled appointments today. I was looking through the list of how many clinics are available in lake communities, Loon Lake, Chittick, Christopher Lake. We're trying to bring that out to the community as much as possible. And I know that in Saskatoon, for example, this weekend, there's a large newcomer clinic scheduled with Dr. Takaya, and we're hoping to see those numbers go up across the province. But as I said, it's been slower than we like, but we are seeing those numbers gradually increase. like we have throughout the opening of the opening plan, where each stage we see those numbers continue to climb, even though we haven't or we've already met our targets, and we hope to see that throughout the summer. Important for folks to recognize, and the Premier's already mentioned it, as Dr. Shahab, once you're qualified, you're always qualified for a vaccine. We'd like you to come in as soon as possible. You know, we are concerned, frankly, both on first and second doses with the Delta variant out there. It's even more critically important for folks not just to get their first doses, but their second doses. And we are prepared, as Dr. Shahab has said, over the next weeks to come, to continue to offer vaccines in as many convenient locations as we can.
Follow up, Adam? Follow up, Adam?
You mentioned earlier that the emergency health order would be removed or rescinded on the 11th. What does that mean in practice as far as what the government can do for public health measures and how that works for people that work for the government in healthcare?
I'll let Scott comment specific to healthcare. What it means is that we no longer will need the emergency measures in place, because we were going to be lifting the public health measures ultimately that are in place. Now we are working on just some general guidance for businesses, for communities on what you may wish to keep in place, such as physical distancing, access to hand sanitizer, ensuring that you have proper sanitary standards in your place of business or your community gathering place, as well as Dr. Shahab had mentioned earlier. Just good old-fashioned common sense needs to continue as well. If you're not feeling well, you should stay home until at such time that you are feeling better, and you might want to go get tested as well if your symptoms are thought to be something near to COVID. So the emergency order will be lifted, as it will no longer be required, as we will be lifting all of the public health measures that are in place. Scott, do you want to speak specifically to the Saskatchewan Health Authority?
So Adam, as I think we've talked about this throughout the pandemic, with the removal of the emergency order, it triggers also the end of the memorandum of understanding. We were very lucky to negotiate with the union, healthcare unions across this province. We were one of the few provinces that did not have to legislate a solution, and we're happy that we did negotiate that flexibility with the memorandum of understanding to be able to move staff around through the pandemic in areas of the most need. That document will expire 28 days after the removal of the emergency health order. So you're going to see some fundamental changes to staffing with respect to, you won't see cohorting in long-term care. You'll see staff moving back to their quote-unquote regular positions, and you'll also see at the same time SHA working with the Ministry of Health to look at what types of services will be maintained from a new service perspective, ongoing COVID response, not just immunization, contact tracing and testing and whatnot, but also staff moving back into their positions and seeing more services in the health sector start resuming across the board over the months of July, August, and certainly into the fall across the board. The delays in services or some of the reductions in services caused by outbreaks in long-term care, acute care facilities. We will be working hard to catch up as we work on our service resumption plan.
We'll take another question on the line. Operator?
We have Lara Famanoff with 650 CKOM.
Hi there. Thank you so much for taking my questions. Testing numbers and positivity rates are much lower lately, and the Saskatoon drive-through is blatantly seeing a lot fewer vehicles than it once did. How long will the drive-through sites remain open, and will they be scaled back at any point?
I think it's fair to say at some point in time they will be scaled back. If you look at the last week, I think we've delivered, I think I mentioned in my opening comments, about 130,000 or in excess of 130,000 vaccines over the course of the past week. If you look at the first 100,000 doses that we delivered in this province, that was over the course of about 3 months. So we definitely are at the peak of our vaccination capability, utilizing, as you mentioned, drive-through capacity, utilizing our SHA appointment-based system, utilizing our pop-up clinics at various places in various communities, utilizing the capacity of our pharmacies across this province and the access that all of those have into so many communities across Saskatchewan, which is allowing us to achieve those 20,000 plus vaccination numbers, in multiple days over the course of a week. So with respect to when we might start altering whether we have access to mass vaccination clinics, drive-throughs, as part of that, yes, will be contingent on, as we transition back to providing as much of the regular healthcare services as we can, and start shifting away from some of the focus on vaccinations and testing and initiatives that we have with respect to COVID, of which those services will still have to be available, most certainly, but maybe not at the level that they've been required over the course of the past year. So I don't know, Scott, if you have actual dates on when you're going to be transitioning back with some of the larger mass vaccination clinics we have, but I suspect that will be as we start to approach the peak of our second doses being made available, and then continuing to start to at a much lesser level of doses each and every day, in continuing to increase our first doses and ultimately following those up with second doses with a relatively smaller population than what we've have been able to vaccinate over the course of the past few months.
Just quickly to add, no, there is no defined time period or date that we've selected to reduce hours or cut back on the drive-throughs. Of course, the current drive-through schedules have been set more by vaccine supply than they have anything else, as well as the uptake on booked appointments, both in pharmacies and at the SHA. As the Premier has mentioned, we have, conservatively 25 to 30,000 dose a day capacity between the SHA pharmacy, our partners at ISC and NITHA. And as we move into this phase and clean up on the second doses, we're seeing lower uptake. So certainly over time, potentially closer to the end of summer, we'll take a really good look at what's happening with respect to vaccination opportunities, and may redirect some of those resources from drive-throughs to more pop-up or more targeted clinics to help stimulate more first doses and second doses. But at this point in time, there's no plan to cut back on drive-throughs at any type of fixed date.
Follow up, Laura?
Yes, thank you very much. Where are the areas of the province where vaccination rates are lower? Will there be any information available on those zones, for instance, listed on provincial websites, say, Southeast, South Central, that sort of thing, Northeast, Northwest? As Dr. Shahab was mentioning earlier, there's some areas where vaccine uptake is quite a bit lower, and that's where we're seeing more cases.
Scott and Dr. Shahab, any comment on that?
Maybe I can make some initial comments. So, like I said, there's actually a lot of alignment right now with where our cases are. Even though our cases are low, they are being reported for the most part in the far north and north of the province, in the north central PA and area, in the northwest, and in the far north. That's also now where we're increasingly seeing some of the new variants of concern, the Gamma and the Delta variants. And I would also like to say further to the comments made by the Premier that when we look at our new hospitalizations, unfortunately, that is also where our current and new hospitalizations are focused on. And I must add that our hospitalizations, again, in the recent 2 to 4 weeks, infectious cases are predominantly in people who are younger than 50. So, our vaccination rates are not just lower geographically in the north and far north, and to some extent southwest and southeast of the province, more rural areas, but the new cases are predominantly in the same populations who are under-vaccinated. And also, we are continuing to see hospitalizations. It takes a long time in some cases to recover, to be well enough to be discharged. So we see some hospitalizations that are non-infectious, but we continue to see new hospitalizations, especially in people who are younger than 50, which we saw in Regina when we had the surge with the Alpha variant. And now we continue to see with the Alpha and Delta variants and the Gamma variants. We continue to see hospitalizations predominantly in young people who are unvaccinated, both in ICU and acute care. Thank you. Thank you.
We'll take another question on the line. Operator?
We have Allison Bamford with Global.
Hi there. It's been about 10 days, I think, since we've been sitting just under 70% of that first dose threshold. What makes you confident that enough people won't become complacent and will get their second dose, given life is essentially returning to normal on July 11th, and you were saying we could be up to 70% second dose by the end of July?
Because Saskatchewan residents are already doing just that. Not only, as we said, the benchmarks that we had put in place, and I explained the covered population versus the Statistics Canada actual population. But what we have seen when we achieved the other benchmarks that we had put forward, 40 plus, is Saskatchewan residents 40 and over did not quit coming out for their first dose, and most certainly are coming out for their second dose. We've now achieved 80% of people over the age of 40 that have received their first dose. 30 plus is proving to be the same. We're 75% in that age category that have now received their first dose, 18%, which we achieved just late last week. We're already at 71% and continuing to increase our percentages there, which really lends credence to Dr. Shahab's words about once you are eligible, you are always eligible, and we continue to encourage anyone that has not made the decision to go out and get their first dose, ultimately their second dose, to do so, and to do so sooner rather than later. We're also seeing in large numbers across the province people coming out for that second dose. In fact, Saskatchewan is leading the nation, the only province to be above 40% of our eligible population that has came out and received their second dose. And so we continue to have faith in the people of this province that they will do the right thing and go out and get vaccinated. By the vast majority, they are proving to do just that. And as I said, that is how we ultimately will keep ourselves safe and those around us safe. But for those that are pondering whether or not to get vaccinated, we are going to learn how to live with COVID. We are going to reopen our communities and our businesses and our society in general. We're not going to wait for you to make that decision, but we would urge you to make it sooner rather than later, because we do have vaccines that are available for you, and we don't want you to be choosing to live with an unnecessary risk that you may be considering. Scott or Dr. Shahab, anything to add?
Well, I think to your point, Premier, if we just look at the numbers and the rapid rise in second doses that we've been seeing across the province over the last few weeks, and just to remind folks that 3 weeks ago we were in schools focusing on schools, which was a lot of first doses. Well, we also had a dedicated first dose strategy. So we did take away a little bit from that momentum on second doses, but we're seeing it come up quite a bit right now. The booked appointments are snapped up, no pun intended, very quickly by individuals looking for second doses across this province. And we expect that that's going to continue well into the rest of the summer as we reach that 70-70 mark, and hopefully 75-75, and then 80-80.
Follow up, Allison?
Yeah, the deaths that we keep seeing, is there any indication that those are from the Delta variant or any other variant?
Dr. Shahab?
I think some of that, committed to bring on a monthly basis. So, we, as part of our breakthrough case rate, so we will bring that now, and maybe in a week or two, as an update on both cases, hospitalizations, and if we can get some information on, it may not always be available on hospitalizing death by variants, but certainly, other jurisdictions, Canada and other countries have shown that the reason that, there can be many variants circulating, and some, not all are considered of interest, some are considered variants of interest. And then from those, only a few are considered variants of concern, VOCs, and at the moment we have 4 in North America, and Saskatchewan has seen all 4. But all 4 are called variants of concern exactly because they are either more transmissible, which all 4 can be, or they are more severe, which you did see with Alpha in younger people and Delta in younger people as well, and other parts of the world have been devastated by that. And thankfully, all 4 the current vaccines provide excellent protection against all four. So again, this is our best defense against COVID, including all current variants of concern circulating in Saskatchewan, is the vaccine.
We have time for an additional question in the room. Arthur?
Yeah, I believe for Dr. Shahab, there was a study that came out today out of the Royal Society of Canada, drawing on some previous findings, but kind of broadening it, finding that there were a large number of, excess deaths that can't be accounted for just through the COVID-19 numbers that we've already reported. And here it was several times more. I believe they said about 6 times more. I'm just wondering whether you think that we've detected all of the COVID-19 deaths in this province.
Yeah, thanks, Arthur. Obviously, we work very closely with our colleagues in vital statistics and e-health, and also we work very closely with the Chief Coroner's Office to do exactly that. That whenever there is some concern about cause of death not identified, we obviously work with the coroner's office. While many provinces and many countries have shown some excess mortality, and some of that could be due to COVID, which was not identified, and some could have been due to other issues that were indirectly impacted by COVID, delay in seeking healthcare. At this point, to my knowledge, we haven't found a big gap in Saskatchewan, but there's something that we are continuing to look at. And, as part of our monthly kind of review, we can certainly look at that more closely. But again, on a case-by-case basis, whenever there's a concern about, what was the cause of death, if it's not always clearly evident, then, screening for COVID is a routine part of, healthcare. In fact, there's been almost, and Scott can confirm that for the last several months, there has been universal screening of all patients within healthcare facilities. So, we don't think we may have missed to a great extent such events. And of course, sudden death in the home setting also, the coroners are aware under the leadership of the chief coroner to screen for COVID if thought appropriate. But certainly that's something we'll continue to monitor. And I'll just see if Scott has any additional comments.
Just on the acute care screening, Dr. Shahab.
Did you have a follow-up, Arthur?
I'm just wondering then why you think there is this wide gap between the amount of excess deaths that we've seen relative to what would be expected and those that have actually taken place. What accounts for that, if not COVID deaths that we haven't detected?
On national data or data from other provinces, I think we do continue to look closely at data from Saskatchewan, and we can certainly, we do drill down to some extent on a monthly basis, and we can certainly bring some of our findings back as we do the monthly review on breakthrough cases and hospitalization and death. So we can look at that from that perspective as well, Arthur. But I would not like to speculate at this point on that.
That concludes today's update. Thank you for joining us.